waste your time chasing perfect. You should know that you're worth it just as you are.
Hey, today we're going to talk about nipple shields. And if you've never seen a nipple shield, this is one. And it's just a soft piece of silicone that has an artificial nipple that is worn over top mom's own nipple. So some of the reasons why these might be used, I like to think of them as training wheels. If there's an issue that we think might be helped by using this. I gotta say, my pet peeve with them is that I see them often handed out by nursing staff really shortly after delivery, like within the first 24 hours, just because it makes it a little bit easier to get baby onto the breast if they're having a hard time, instead of reaching out for an IBCLC or a breastfeeding specialist to really work on what the problem is, why they think that they might need a nipple shield. I always think it's good when we're using tools with breastfeeding to know that we're using the right tool for the right purpose. That way you know when you can stop using that tool. So, pros of a nipple shield. For one, it does provide some firmer stimulation in the baby's mouth. So in particular, I like to use it with earlier babies. So if your baby's in the NICU or late preterm, which means they're born before 37 weeks, sometimes they need a little bit of extra stimulation in their mouth to help them feed. And that's what this firm nipple over top of your nipple would do. Another benefit to nipple shields is that it does offer some level of protection if we have a case where mom has really damaged nipple. Sometimes I found a nipple shield be helpful to provide some protection while we let that nipple heal. Now again, if you're getting damaged nipples, we need to work out the cause of why your nipples are damaged, and using a nipple shield is not going to fix that cause. And sometimes it still doesn't help because babies will still latch improperly on these and cause pain as well. Another pro of the nipple shield is that if I am working with a baby that has developed a preference for a bottle and is refusing to latch at the breast, this is the best tool I have found to help bring that baby back to the breast if that's the mom's goal. So babies get used to that firm stimulation of the bottle nipple in their mouth, and then they come to the breast and they feel the soft breast tissue, and they're not interested in latching because they're looking for that firm stimulation of the bottle nipple. So if we put this on mom, they've got the firm stimulation and we can bring them back to the breast. Another pro of the nipple shield is if I'm working with somebody that has inverted nipples, meaning that their nipple, instead of sticking out of their breast tissue, goes in, or if there's somebody that has flat nipples. Now, flat nipples are kind of a debate because I've had a lot of moms that I've seen that are worried that they have flat nipples and that it's going to be hard for them to breastfeed. And then when I actually do an exam, their nipples aren't actually flat. So if you're worried if your nipples are flat and you might need one of these, see an IBCLC and get the official word. But basically, if your nipples really are flat, these might be helpful, at least in the early days, helping baby to latch on. Another pro of the nipple shield I have found is that if I find that a mom is at kind of a breaking point where she's ready to just give up with breastfeeding, it's overwhelming, too hard, painful, whatever it might be, and we're thinking our options are either not feeding at the breast or feeding at the breast with a nipple shield, I'm always going to choose feeding at the breast with a nipple shield. That gives us time to work on whatever issues that mom is experiencing, to help her meet her goals and get over whatever current roadblocks she's facing. All right, some of the cons of a nipple shield. So for one, babies will get used to the feeling of this firm nipple in their mouth, and so they might have a hard time latching without it if you start using it. So another con with the Nipple Shield is that it is an extra device that you have to carry with you everywhere you go when you breastfeed. And you have to be able to keep it clean. So washing it in between each feeding with warm soapy water, which you could see that might be a little difficult if you want to go out for any reason and you're not just at home. Another con with it is that babies will often start to play with it and kind of pull it up when they're going to latch on. Sometimes I've seen them sort of whack it off out of place, and then you've got to readjust. So again, extra little device that makes it a little more complicated than maybe it needs to be. Another con is that it is a barrier between your breast and your baby. So you can see that if your baby is latched on here, it's not directly onto your breast. So that little bit of barrier, although it's nice and thin, can cause some issues when it comes to milk transfer sometimes if it's not being used correctly. It can also cause a little bit of less stimulation to your breast, so sometimes it can affect milk supply. Another con is that it does put you at risk for something called mastitis. The Academy of Breastfeeding Medicine included in their most recent update of mastitis, which we'll cover in a later video, that nipple shield use in itself was a risk factor. I would consider another con with using a nipple shield is that it doesn't provide as great of a seal at your breast as if just your baby was latching to your bare breast. So the simple fact that there's this barrier and it doesn't always seal beautifully around, when babies go to latch on and milk gets flowing, sometimes that milk will kind of leak all around the shield. Babies will move around. The seal's not always 100%, so it can get messy. The final con I would say about using a nipple shield is that it does require a weaning process, which I feel like isn't always talked about or introduced to moms when they're given one of these, that, hey, sometime down the line, there will be a process of weaning from this. This isn't going to be an always tool. Now, I've talked with some moms who said that they went on to breastfeed for a year using a nipple shield the entire time, which astounds me. And I can't imagine how difficult that must be. So it can be done, but it really shouldn't be. So the weaning process in itself can take a bit of time. Sometimes it can take several weeks to get a baby to learn how to latch to the breast without this. It can also be kind of frustrating. It takes a lot of persistence and hard work. So again, it's something that we need to use as a tool for the right reason, because if we're just using it out of ease, know that there's going to be hard work down the road. Okay, so what's the takeaways? For one, I'm really glad that nipple shields exist. There's a lot of situations where I have found them super beneficial, and I'm glad that they're there to help when we need it. Number two, no, I do not think that you need to put this on your baby registry. I've had some moms ask me that. If there is a situation that you come into where you feel like it might be beneficial, ask for help from an IBCLC. In the hospital, they've got these ready to hand to you if you do need it. And when you're out of the hospital, they're available so widely at a lot of stores. In our shop at Milk and Honey, we have some nipple shields, so don't worry about how you're going to access them if you do end up needing them. But no, I don't think that you need it on your baby registry. 3, they're not usually a long-term solution for whatever breastfeeding issue they're being used for. So we use them as training wheels and tools to get you where you want to be. Number 4, if one of these is recommended to you by anybody for any reason, seek out IBCLC care early, frequently, to ensure that this is being used for the right reasons or if it's even needed at all, and that you understand the why. All right, that's it on all of my thoughts about nipple shields. Hopefully you found it helpful. And if you're wondering if you might be in one of those situations where it could be helpful for you, please reach out and maybe talk with one of us about it. Or if you're already using one and you're wondering if you might be able to start getting away from using it, please reach out to one of us. Have a good day.
If you got love, love.